Today we will see about the Health and Family Welfare Program Part 2. Those who did not listen my lecture Part 1, I will just brief it. In the Part 1 lecture, we just have seen about the definition of Family Welfare Program and the objectives of the Family Welfare Program, and there is a great milestones of the Family Welfare Program. There are various program, family planning program changed into family welfare program, and throughout all these programs, EPI program, universal immunization program, all these programs were continuously going, the research is going on, and what all the changes they have brought it in each everything we have seen in detail. And at last we have discussed little about why the India's health spend is so less when comparatively with China. The China's population also so high like India, but they could able to spend 6.6%. Why we cannot? That question also we have answered. Why? Because of the military. One more thing I would like to say, the population is heavy with India and China. But if you compare with the India and China population, Indian population has a healthy population. It's not the thing, what do I say, rather than telling the healthy population is like, I can tell that we have a good human resources. If you take China, they have old age population is very heavy. But if you take India, we have the adult population, adolescent population, children population, all are in a very high position, not like 80-75% of the old age population. So that's why all the other countries, India is the platform to sell everything. Either the app or Microsoft, whatever the technology, India is the big platform for the other nations. In all nations, looking at the India, we are doing the wonders. That's what we have seen. We have little bit discussed about the economy. Yes. Next we will discuss about, we will start discuss from each programs. These programs and all will be coming for 5 mark questions. You can easily remember and write when you understand the concept. The universal EPI has been changed into UPI. 1978 EPI program, it was like a expanded like a program of immunization it was, and 1985 it is named as UPI, Universal Program of Immunization. Future, it became a part of CSSM program. Here I told you in the history, CSSM, they have included the adolescent health. Until then, all these programs, they were concentrating separately female and this one. They did not think that they targeting the mother after marriage. But it was not, high impact was not there. So they started to the research was telling anemia is the root cause of the problem, none other than any other causes. So they started to include the adolescent health. Then it is throughout all the program, it is carried out in a different form and fascinated names with different strategies with like what I will tell, with the innovative strategy we can tell that one. Okay, let us come to this universal program of immunization. When they asked about this EPI program or UPI program, you just mention the year and it is become a part of CSSM in 1992. You tell it is nearly covering 2.6 crores of the newborn and 3 crore of the pregnant women it is covering. Currently, if you see, 27,000 cold chain points were there. Cold chain, you know what is cold chain? Is carrying the vaccine with the correct temperature from the manufacturer place to the place of implementing the vaccinations. So there are warehouse and many things will be coming. So you should need the vehicle or the transport vehicle also should be comfortably made with the storage equipments, right? So we have nearly 76,000 equipments. Storage van also it's available. Nearly 700 vans are available to keep it in this one. And every primary healthcare center we have according to this program, they have set the ILR. In a district level, there is a walk-in cold room will be there and ILR will be there. ILR 160, ILR like that, various this one, and they have separate connections and the power backup also is being given. And the ice packs also there. Even the power bank go also in the cold chain. If you are not opening, the temperature will be maintained 2 to 8 degrees Celsius. That is the beauty where they keep the ice packs in the refrigerator. Yes, if you visit primary healthcare center, you will understand that. Okay, come to the point. When the universal program question has been asked to you, you just write the year and write it that it is become a part of CSSM 1992. It's covering this many children, 2.6 crore newborns, and also the 3 crores of the pregnant women, and the 27,000 cold chain points and 700 refer bands available with the storage equipment of 76,000 equipments are available currently. UPI to prevent the 11 vaccine preventable disease. We might have seen expanded immunization program in the beginning. It was like only 6 killer diseases, right? But now currently you see 11 diseases. What is these 11 diseases? DPT like diphtheria, pertussis, tetanus, polio, measles, rubella, tuberculosis, hepatitis B, haemophilus influenza, type B, rotavirus and pneumococcal vaccination. Then in 2012, pentavalent vaccine was introduced. But when I was working in Saudi, 2002 itself this vaccine has come. But when the other developed countries are introducing, 10 years after only India it is coming. So then also it's okay. Pentavalent means what? It is the replacement of the vaccine of DPT and hepatitis B vaccine. What is called pentavalent? So what is DPT? This is called pentavalent is called DPT HIP. Diphtheria, pertussis, tetanus, haemophilus influenza and hepatitis B. No need to give 2-3 vaccines differently. The one vaccine will cover the 5. So they have introduced in 2012. We will come to the CSSM program. CSSM program was introduced in 1992. It is the CSSM is called the Child Survival and Safe Motherhood. CSSM is launched in the 20th August 1992. Main objectives of the CSSM: strengthening the UPI program. They have renamed it. Also it is strengthening. Let us see how they are strengthening it. And giving the ORT to the children less than 5 years. Because most of the children are dying with the diarrheal diseases in India. And prevent the blindness below 3 years of the children. How to prevent blindness? Because blindness is coming mainly because of the vitamin A deficiency. So they started to supplement the vitamin A supplement to the children. And the adolescent health, I told you, anemia is the root cause of the problem of MMR in the country. They find out by the research. Before implementing CSSM program, they have, that is the reason CSSM adolescent health when implemented. So they were giving iron and folic acid supplementation. Whom they are giving? Mainly pregnant women, lactating mother and children below 5 years also they have started to give it. And they bring the improvement in case of the infant and mothers and in the community level. So they bring improvement. How they do the home visit and other activities they were doing. What are all the activities they are doing to improve in the community level? Why they are focusing in community level? Yes, currently if you see community-based pediatric, community-based psychiatry, health care cost of the country will reduce if you go to community and prevent the diseases. How the health care? Either the government hospital, it's a free of cost, but it is a burden for the government. So the admission will be reduced, the healthcare cost will be reduced. That is the goal of the government. Okay, let us see. We have seen bringing some improvement, some activities they are doing in the community level. Let us see what is the activities are they are focusing on the child and the mother. The children mainly the newborn care, like essential newborn care, immunization, diarrhea management. How the diarrhea management? Even they were maintaining ORS corners. So ORS corner means people will be going to some petty shop to get some matchbox or vegetables or something. So the ANM will be approached there and they will be giving all the ORS packets and important vital this one given to them. Then they will motivate. They can easily access this one. No need to walk and go to the primary or the sub-health center. Then management of ARI and the vitamin A prophylaxis. Let us see what are all how much amount they are giving. I will explain it. Mother, how many lakhs of unit they are giving. Under ARI, what we are doing, we will see that. Then the mother also immunization they are giving. Immunization mainly TT. Only in India we are giving. The other countries they are not giving DT and all. And prevent and treat the anemia for this, and the antenatal care. Best antenatal care. How they are giving antenatal care? That also minimum 3 antenatal visits. Early identification of the maternal complication. These 3 visits will be helpful, and delivery by the trained personals. You know all these old milestones before CSSM. Most of the deliveries are conducted by the DAIs. But what government has done? DAI training program they were conducting. So the DAI training program, the government started to give incentive to the DAIs. So you conduct the delivery, but inform and bring them there, like that. They trained them that you have to implement these scientific measures. If you do like this, we will give you implement, and you link whomever you are doing. So slowly DAIs was disappearing. It became the skill birth attendance training. And promote the institutional delivery, birth spacing, management of obstetric emergencies. Okay, obstetric, here we have seen children, right? Here some lakhs, here if clearly I have written here, the children, all children in before 9 months, below 9 months, up to 9 months, 1 lakh unit given. And then 2 lakh unit given for the 6 to 5 year children. And anemia, promote the adolescent children. We have seen about iron and folic acid supplement. You should also know how much iron are given. And 6 to 5 years, 20 microgram of the elemental iron and 100 microgram of the folic acid. Per 100 days it is given. 6 to 10 years, 30 microgram of the elementary iron, 250 microgram of the milligram of the folic acid per 100 days they were giving. So specifically they are giving all these things. And control of RTI and STI. What is RTI? Reproductive tract infection, sexually transmitted diseases. So it is very costly when you are giving treatment to the AIDS patient. The package, the viral, antiviral, retroviral therapy package is nearly 5,000 rupees. That is the thing they are doing, that they have joined with the NACO. It's like a public-private partnership. NACO is a non-governmental organization, voluntary organization coming forward to help. What they are doing? NACO is providing assistance for setup of RTI clinic. Where they set up RTI clinic? Of course, in the primary healthcare center. What they are doing? They are doing a toolkit. They are giving a toolkit. This toolkit where coming from? NACO plus central government is giving the toolkit. NACO is setting up the clinic. Toolkit given by the central government. Lab technician appointment by the state government. So though this many program is centrally sponsored, it is also state government implemented through with their own people. Right or not? So it is like a public-private partnership approach in other way. A non-governmental organization also coming forward to help. So this is the RCH, I mean CSSM. So main thing they were doing. So next, if you see RCH package, this we have seen blindly this immunization and the other thing. RCH package means it is about, it started from the 15/10/1997 to 2001. Phase 2 is 2001 to 1/4/2005. This phase 2 is merged with the NRHM. So before go to NRHM, you can see RCH. Okay, let us conclude the CSSM. So CSSM program, if they asked for the 5-mark question, you can write it. Child survival and safe motherhood. Write the objective. ORS corner has been given. Blindness has been controlled. Vitamin A prophylaxis. Who are all the beneficiaries and the pregnant, lactating and child. And activities are given. The newborn care, immunization, diarrheal management and ARI, vitamin A prophylaxis. Mother also, what all the treatment they are giving. This much is enough. In a detail, little bit you can write about this much unit. That is also, see, why I told this one is same, because Whenever, see, UPI program has been implemented along with the CSSM program, right? Because immunization, they brought it into it. Now, CSSM is very good. When the RCH package is there, they took this, put it in one of the component in RCH program. Clear? So now if a 5-mark question is coming in RCH, that you write it when the RCH package has been started. It was phase 1 and phase 2. What is this package? This package is is the 4 component. CSSM, what is that? Child survival and safe motherhood, ORS corner, ARI control, and control of ARI, RTI, different. What is ARI? What is RTI? It's different. This is acute respiratory tract infection for the children. Here is the RTI is the sexually transmitted diseases or reproductive tract infections. Then client-oriented approach. As I told you in my introduction class, these are all decentralized approach has been started. Goal-oriented approach has been started. Participatory approach has been started by the RCH. Then the family planning services. So now you have written about the CSSM, what you have written, same thing, CSSM, RCH package, you can write whatever the objectives, you can write every community program, all these family welfare, reduce the IMR, MMR, control the population, implement the family planning, and improve the adolescent health. These 5 concepts, you please remember it and you write it, you will get it. That's what. So I told you this RCH package, when you are writing, please write the package and write the aims of this one. And under this each package you take CSSM, you write what are under CSSM they are doing, how many lakh unit, ORS corner, AR, acute respiratory tract infection control, how they are treating. And RCH program is completely vertical to integrated program, camp oriented to the client oriented program, target approach to the target free approach, goal oriented approach, quantitative approach to the qualitative approach. And control of RTI STI will be controlled with the help of the NACO and also with the central government and state government. NACO is setting up the clinic, RTI clinic, and the toolkit is provided by the central government. Toolkit is nothing but 3-dot test. They will tell 1 drop they will be putting, and like a pregnancy test, what you immediately you can rule out the HIV, and lab technician given by this one. Next is the RCH package 2. So hope you understand this one. RCH package 2, it is merged with the NRHM. So more specialized health services are initiated in RCH package 2. So when we see NRHM and RCH package together, we can see. So this is becoming a long lecture. Let us finish with UPI immunization program, CSSM, RCH. So next class we will see about RCH2 and NRHM merged. This same thing it is coming. We are not omitting anything with the NRHM, and new innovative strategies are coming. So you wait for the lecture. What are all the new NRHM innovative strategies? What are all the advantages? Let us see in the next lecture. Thank you.